Hey, folks, Steve Glenn here with BeSmartPrepping.com. I want to talk to you a little bit about another aspect of your preps. I'm sure that most of you have got, antibiotic cream and antibiotics and gauze, and I've talked a little bit about, clotting material, for stopping bleeding, and hopefully you got some cold medicine, decongestants, and vitamins for the kids and vitamins for adults and stuff like that. Something else that you should get, and I don't have all the pieces right here, but I'll describe them, and then you'll kind of know what's going on. But have yourself some medical devices. Okay, of course, whenever you go into a doctor's office, what do? They first take you into like a little exam room, and the nurse is there, and she puts the little thing on your finger, right? And it measures the amount of oxygen level that you're getting in your system. Normally, that should be about 95, 96, for most people. It also measures your heart rate, which is important. And then they usually stick a thermometer in your mouth, right? Get your temperature. Want to make sure that that's right. What else do they do? They usually weigh you. Um, and that's about it. Now, if you're a diabetic, they'll also sometimes check your glucose level as well. And so it's good to have some of these devices around because if you've got those along with some medical books, some pill books, you can kind of do a little bit of diagnosis yourself and get some ideas about maybe what's wrong with a person and maybe some things you can come up with to try to treat them if doctors are not around. Okay, there's a lot of information out there on the internet. A lot of it you can download. There's some good books out there you can get. Find yourself some diagnostic medicine and pill books, and have a few of those laying around. Maybe some books on natural remedies, and then have a few of these other things. Here's a device right here, and I'll have some of the links for these down below. So you can order them if you want to. This is a Volodine 2500. And so basically what this is it measures your lung capacity. So, people that don't have a lot of lung capacity, this will basically tell you if that's the case or not. But it's got a little gauge here on it, and you basically put this in your mouth, and you inhale, and as you inhale, this moves up here, and the idea is to have this move up at a constant rate while you keep this little valve here sort of in this range right here. Sometimes it might go up a little higher, but you try to keep it in this range. And if you can get yourself up around 2250 to 2500, then you've got good lung capacity, and you're getting lots of air. I'll give you a quick little demonstration here. So I've got it past 2,500 milliliters there. So, but the idea here is you can use it to measure someone's lung capacity. And what you might want to do is have some of these, for the people that are around you, know what their lung capacity is, write their name down, what their lung capacity is. I've got about 3 or 4 of these Wrist-Tech blood pressure monitors, and it also has an irregular heartbeat detector on it. So this will show you your blood pressure, and it will also take and it automatically inflates, and then it also shows you whether you got any sort of irregular heartbeat, and it's got information on where things should be, whether you got hypertension or not, what the systolic and diastolic should be, and so this lets you know whether or not you got the blood pressure issues. Blood pressure, they say is a silent killer. If you got high blood pressure, then you want to address that somehow. Relaxation techniques and diet, blood pressure medicine if you can get it, if you got it. On medications and stuff, you can get these Now, of course, you can just use a knife or something if you want to, but they've got these sorts of devices here. This is a pill. This is a pill splitter. Okay, and basically what you do is you open this thing up. There's a little slot right in here. You put your pill right in here, and then there's a razor blade right up here. And what you do is you close that down, and it splits the pill. And then when you open it up and you tilt it, both pill pieces end up right down in this little tray right down in here. So what you can do is you can sort of make your medicine stretch a little bit longer than it normally would by taking maybe a half a dosage of your medicine. And maybe half a dose of your medicine is better than no medicine at all. Okay. Also, if you do have some diabetic people around, you want to have a glucose meter. And so, and then you have these little strips here that you use to get the blood from your finger. This is a little device for pricking your finger so you can get a little bit of blood out, and it does so in such a way that it keeps you from getting infected. Of course, you still want to put a little alcohol on it afterwards, before and afterwards as you do it. But this will tell you what your glucose level is, and it will also take and allow you to store that in a log file. But you might want to write it down and use this for several people. You've also got, you want to make sure you've got a couple thermostats, or thermometers, excuse me. So an oral thermometer, for adults, for older kids, that sort of thing. I've got a couple of those. I've got a rectal thermometer, which is good for babies, and they can't hold anything underneath their tongue. You can do underneath their armpit, and then you take, I think, 1 or 2 degrees off. I forget. I'd have to check on that. But you can also use a rectal thermometer for babies. And then for kids also, they've got digital ones where you just basically put it in the ear, you push a little button, and then it beeps, and you just read it right off of there what the temperature is. So have a few of those. You certainly want to know if somebody's got an elevated temperature. If they've got an elevated temperature, a fever, that usually indicates some sort of infection. And then you're going to want to figure out what's the best way to treat that infection. Hopefully you'll have more than one different kind of antibiotic available to you. The other thing is, as I mentioned these things, you want to, as you collect that information on the people that are around you that you care about, and you're writing it all down. The other thing is you may not be able to go see a doctor, but you may be able to get a hold of a doctor. You may be able to call into some place and say, hey, this is so-and-so. I've got a person here. And of course, this is what paramedics do. The paramedics they pick somebody up, they're injured, they got a gunshot wound or whatever. Of course, they stop the bleeding, they try to stabilize the patient. But as they're heading towards the hospital, they're getting all the vital statistics on this person that is injured in front of them, and passing that on to the doctors at the hospital and the nurses there, so that when they arrive, they have some idea of what the condition of this patient is, and how critical it's going to be to take care of them. And that's sort of a part of triage. So, you may not be able to get a hold of a doctor or nurse. You may be able to just leave a message, and hopefully they'll call you back. But if you can call up and say, hey, here's the person, this is their age, this is their blood pressure level, this is what their heart rate is, this is what their oxygen level was, this is what their temperature was. If they're diabetic, you can give them a glucose level. So as much information as you can give them about the patient, that helps them, to come up with a diagnosis. And they may be able to say, hey, normally, we have to see you, but in these chaotic times, in a shit is the fan situation, they may be able to take and call in a prescription for you. And then all you got to do is go in and find a pharmacy somewhere that's hopefully still up and running, and go pick up what you need. So these medical devices are not that complex. They're designed for home use. So as long as you got about an 8th grade or 10th grade education, most of these things can easily be used and understood by someone of that age. So have some of those things around. The life that you save may be your own or someone that you love. All right, so I hope you found that interesting, useful, insightful. If you did, please give me a thumbs up. Subscribe to this channel if you like. And to each and every one of you, God bless. Bye.